They did. They told me 50. Good evening, everyone. I wish you could see yourselves from here. This is a great crowd. The Affordable Care Act is in the process of being repealed, so they always say that when there's crisis, there's opportunity, and it's very nice to be with a crowd of single-payer advocates who've been at this for a long time. I've run into a lot of old friends this evening, and I know that many of you have been at this for many years, but I want to acknowledge just one of them, and that's my mother, Priscilla Bassett. Priscilla Bassett. She was, well, thank you. When I saw Gail Brewer when I walked in, I said, she greeted me, we run into each other, and when I said, but my mother's here, she jumped up. Now, my mother is a lifelong activist, now a senior activist, and she likes to point out that seniors are among the best advocates for single payer because Medicare has been a form of single payer, so they know what it means to have a single payer system. And she was there at the Trump Tower this afternoon. Talking about it. So I'm very proud to be her daughter. I'm also very proud and honored to be here with you this evening with fellow advocates, activists, members of the labor movement. I was myself a member and an executive officer in the committees of interns and residents when I was in training at Harlem Hospital. It is now an SEIU affiliate, and I learned a lot of lessons about organizing strategy. We had our own strike there for improved quality of care, not for bread and butter issues, to improve the quality of care, and that was an experience that I learned a lot from. So I was asked today to reflect on the legacy of Dr. King. So I'm going to talk more about that, but because I know that this is a strategy meeting, and I think that we have a lot to learn from Dr. King about strategy, but I thought I'd start out with a little personal story about when I was 11 years old in 1964, when I had the opportunity to meet Dr. King. The audience who are in my generation, and it looks like some of you are, may remember that in New York City, this was 1964 was the year of the World's Fair. And in early April, I must have met Dr. King sometime in April, the Brooklyn chapter of the Congress on Racial Equality released a statement urging everybody, their followers, their allies, to engage in a stall-in of the major highways leading into New York City on the opening day of the fair, which was on April 22nd. And they had pithy slogans like the World's Fair is a luxury, but a fair world is a necessity. And city officials, particularly Robert Moses, were alarmed. They thought that this was going to bring the city and the fair to a halt. So sometime between when Brooklyn Core made this announcement and the World Fair opening day, I was an 11-year-old child at a private dinner party in Riverdale. I now recognize that this must have been a fundraising party that Dr. King was obligated to go to. We forget often the back, all of the behind-the-scenes activities that activists have to participate in and that he had to do to support the infrastructure of the civil rights movement. There were only 2 children there, and we were lucky to be entertained by the actor Ossie Davis, who I suspect enjoyed our company more than the other people who were present that evening. And I was telling him what I thought of him as an actor, and Dr. King came by, and I told him, as an 11-year-old, then I was worried that the ambulances might not be able to get through because of this planned stall-in. And he listened to me, and he was very nice, and he said, we've thought about that, and we've taken care of it. But I now know, looking back at this time, that there were many members of the civil rights movement who criticized the Brooklyn Core for this stall-in plan, including their own president, James Farmer, but Dr. King was not among the people who publicly criticized Stalin. He privately wrote that he thought this was a tactical error, but at the same time he asked his colleagues if they had not made a mistake in their quick move to distance themselves from the core action. While he didn't personally agree with Stalin, he said that he understood extreme conditions led to actions like this, and he asked if the Stalin that was being planned in the Senate at that time, which was a filibuster of the Civil Rights Act, wasn't more disruptive to far more people than the planned Stalin. This is the real Dr. Martin Luther King. The version of him that we have all now learned in our grade school history books and commemorations that will be taking place over this weekend and in the week, transformed him from not as a radical, but as somebody who was, as though he almost charmed his way into the legislative victories that were associated with the civil rights movement. They turned nonviolent action from a radical act into some kind of passive speechcraft. So we've lost, in the decades since his passing, the radical Martin Luther King. It's true, he was peace-loving, but he also was engaged in strategic, tenacious, and profoundly disruptive form of nonviolence. Now, the whitewashed version of Martin Luther King is held up against the tactics of the Black Lives Matter protesters, but the truth is that the movement for Black lives carries forward the playbook of the civil rights movement, and their icy reception in the mainstream media mirrors the criticism that many so-called moderates made of the civil rights movement. Dr. King often spoke out against those who told Black people to be patient in face of oppression. So Dr. King was not afraid to speak out, name names, and he was not afraid to talk about racism. It's true. We have to have a conversation about race. Now, you all have his quote. It's right here. Of all the forms of inequality and injustice and health, is the most shocking and inhuman. He made this statement when he was talking to the Medical Committee on Human Rights in Chicago in March of 1966. And he was talking about the discriminatory behavior of doctors and hospitals. And he was making the case that the Civil Rights Act ought to take care of this by force of law. And you may know, many of you, that Medicare was really what drove hospital desegregation. He wasn't just speaking about the South. He was also speaking about the northern hospitals that had figured out how to remain segregated hospitals using subtle techniques that still are in place today. Now, of all these lessons, and I hope you'll just bear with me, I think I want to focus on three. One is that as we face the opportunities ahead of us, we also have an obligation to talk about race and racism. Many of us don't see the connection between many of the successes of the civil rights movement in the 50s and 60s and the determination of people like Reverend King to talk about these facts of life, that these conversations are part of what led to the policy change and the cultural transformation. We sometimes mix up cause and effect, because I believe that it was explicitly this discourse that enabled us to put together an effective civil rights movement, one that we recognize today. So while there have been big gains in culture and law, the fact is that half a century later, class, health, education, things that we all know as the social determinants of health, remain heavily racialized in our society, and the promise of the civil rights movement, echoed today by the movement for Black Lives, has not been fully realized. We need to name racism and make injustice visible. We need to keep our eyes on the prize. We also need to stand up. Those of us who work in health and in medicine and public health, you know, we often think of these iconic speeches. I love a good speech. And Martin Luther King made many of them. I was listening to some, every year I listen to some of them. I listened today to the drum major speech. But we often associate them with individuals, wonderful ministers in the oratory of the Black church. But we have to turn this into a community conversation. We have to have each and every one of us here to begin to speak up and speak out, because we all have the opportunity to change things. I wanted to mention about my mother, who spends most of her time in Sullivan County, a county that went for Trump, but also passed a single-payer bill. So we all have to remember that there are alliances that we need to form that we may not always think about. Think about that. A county that went Republican and passed single-payer. This is the lady who figured out how to do that. We're still working on it here in our city. So we have lots of alliances. They're ones that may seem more natural to us: environmental sustainability, LGBTQ struggles, class-based issues, and there's some that may not seem as natural to us. But now, as threats loom larger than ever, I urge you to reflect on Dr. King's stance and how he handled the stall-in in Brooklyn that the 11-year-old Mary Bassett told him worried her so. He disagreed, but he still disagreed silently. Facing the world, he united around the very potent intentions of that. He reoriented the civil rights movements towards their real enemies, the ones who were blocking legislation in Congress. So I believe that this is what healthcare justice demands of us. We have to keep on building momentum, seeking alliances. We have to not only expand proven programs and policies and services, we have to look to the future that will guarantee these for all of us. Dr. King, as you know, towards the end of his life, became increasingly courageous. He spoke out against the war in Vietnam. He spoke up for the Poor People's Campaign. The full title of the March on Washington was the March on Washington for Jobs and Freedom. So, as we reflect on his legacy, we have to think how much we lost when we lost him, and what a burden all of us now must joyously raise up as we look forward with hope to the future. Thank you very much.